So ours is aimed not just at a local place, it is a model which can be replicated to the entire world. So this was our dream, and we started it a year ago, to be exact 6th of March. And our mission was to connect proportionately the ancient medical wisdom with, and we have got one of the seance of ancient medical wisdom sitting here, Professor K.S. Vishwanath Sharma ji. He is fully 90 plus and a giant in Ayurveda, So we tap wisdom from every source, wisdom from all the sources. And with modern medicine, energy medicine. Now, energy medicine is a new concept which Professor Hegde had introduced 3-4 years ago. We have already started working on it. We wanted a place to document all these things and show you. So these things have to be done in a modernistic fashion for the younger generation to believe us. So we customized a special innovative telehealth initiative, thanks to the gift of that infrastructure by the healthcare info solutions people who were given a large donation, but again by donors. And all these efforts, our mission is to optimize human health expectancy, not just mere life expectancy. Health expectancy is different from life expectancy. So with this effort we started. Let's see where we have gone at the end of a year. I'll shortly give you rapidly what we have done, and thanks for your indulgence. Next, please. Now, the word path-breaking came when Dr. E.S.K. brought for 10 minutes the Consul General of Australia recently in December to our department. We said, put down your thoughts. And what did he say? Thanks for the opportunity to see your path-breaking work. So we knew that we have broken some path. So at least we were satisfied that an outsider who came and saw our center for a few minutes could have that impression. Next, please. And at the end of the first year, what is sticking out is that we have been able to translate our dream of a virtual paperless hospital. I believe this is unique in this country. All our nurses, all our doctors, they're all trained to store everything in the computer, whether it is an iPad or a tablet or a computer PC. They come to you, tell about 10 patients from the iPad or their status. If I ask them even 100 questions, they will answer in 100 seconds. Now, this sort of exercise cannot happen with the traditional laborious case sheets which accumulate over years in the basement, gathering dust and allergy to others. So, I think it is an experiment and I believe that this itself, by itself, is a research product of the TAG VHS. I think I must give full credit to Mr. Venkateshan and his team of people who have devoted night and day to prepare this over a long period, conceptualize it and translate it. As you can see, our registration, the data entry into the electronic medical record, doctor's consultation, everything goes on the electronic record. Even the little bit writing that we do, we are trying to take it away so that at the end of the next year, it will be hands-free, paper-free program, excepting that the patient will be given the case records. The discharge summaries are generated in 5 minutes. Nowhere else in the world you can get such exhaustive information. Not only that, next please. These things are done with such facility by the people. They are all become experts now that we can print an event summary in 5 minutes, discharge summary in less than 10 minutes, and these are globalized by networking. Now you are here today, you go to America tomorrow, you want your case record there, in 5 seconds it will be there. You want to go to somewhere else, you want to take your case record, show it to somebody there, fine. So it's anywhere, anytime, you will get these case records. They are stored with utmost security and greatest care. So I think this sort of all-comprehensive thing is not offered, as Dr. E.S.K. said, not only for the paying people. We have over 650 juvenile diabetic children in our center because this center is attached to the diabetes department. All of them get lifetime comprehensive free care. For 45 years, we have been giving them continuous free care, not just free medicines. We have been giving free comprehensive care for all their comorbid conditions, emergencies. Everything is done at zero cost, no cost. And this has been going on day in and day out. And I believe that this is one of its kind service offered in our country, perhaps in the world. Next, please. Now, our first thing was that sort of all of the present medical claptrap believes in random controlled trials as the be-all and end-all of evidence-based medicine. Both Professor Hegde and I totally distrust this for a very simple reason. They are not honest, they are doctored, they are tailored, and if you use the other word, they are sexed up statistics. So, we believe in this Krumholtz theory that patient-centered outcome. Okay, what is patient-centered outcome? If I have got 10 cases of diabetes or 10 cases of stroke or 10 cases of heart attacks, we have treated. We have treated 100 cases. What is the outcome? If 80% of them did well without the traditional laundry list of medicines and continue to do well over the years sustainedly, then that is the best one. We don't need any control. We have now got people going on to more than 5 years using these techniques and doing extremely well. Now, there are a host of drugs which are used all over the world. No doctor is exempt from it. They are called COX-2 inhibitors for pain. They are called NSAID or non-steroidal anti-inflammatory drugs. Then a host of drugs I have mentioned here, I don't want to name it now, for diabetes, which are all dangerous. Dangerous for our internal organs, heart, kidney, liver, what have you. Muscle, all these are damaged due to intake of these over a long period for so-called prophylactic purposes, preventive purposes. And there are a host of drugs under the alert list of the Food and Drugs Administration of the USA. They are called the red alert and black alert. These are all not used in our hospital. That's one principle. That means we have a safe drug protocol. Now, every hospital must, I feel, publish the safe drug protocol. Then only we can accept that as a good thing. So 1 year of follow-up shows that these patients are doing extremely well, both clinically and in subjective parameters. The detailed analysis of all these are under preparation, and you can see that this journal, of which we have got both the chief editors. Professor B.M. Hegde is the editor-in-chief, co-editor-in-chief, recently taken over from the legendary Professor Rustum Roy, is Professor Hans-Peter Dürr. That is why he is here today, and we will publish it in this journal as well as in other journals. Already some things have come in peer-reviewed journal. Now ours is a super peer-reviewed journal with several Nobel laureates in its editorial board. Next, please. Now, this gentleman did a wonderful thing by discovering this small circuit. Professor Hans was saying in IIT yesterday, we do not grasp all that we experience. What a wonderful word. We do not grasp all that we experience. We experience sunlight, but we do not grasp the meaning of sunlight. Now, this man did grasp and produced electromagnetic circuit in a small instrument. Glenn Gordon of Seattle, who is a very dear friend of Professor Hegde, he devised this and cured his heart from a condemned transplantation stage by the Mayo Clinic and lived for 17 full years bicycling all over United States. Last year he passed away, but he bequeathed this for the betterment of humanity without commercial interest to Professor Hegde, who has improved this into a small little cell phone type of instrument, which is much more elegant and equally powerful and potent. And we have started using this for the last 10 months. It's called the BM pulsar. It emits pulsed electromagnetic energy. Next, please. Now, my interest being diabetes, type 1 diabetes, we have got over 600 children, and they take insulin morning, noon, and evening. And they develop local swelling, their insulin doesn't go in, they have got local cavitation of the disappearance of the fat called lipoatrophy, all sorts of problems. Their sugar is not controlled, not because we don't give insulin. We give insulin, but it's not absorbed because of local thickening and local factors. Now, this instrument I found 50% of the insulin requirement has come down for all our juvenile diabetics whom we have given. Now, that's a great news for all our children and all of you, but may not be for the drug company because they want to sell more. The first case that we treated in TAG Center on the next day of inauguration, March 7th last year, was a case of acute heart attack. A man came from Bangalore to see Professor Hegde, his friend. He had an acute heart attack. Believe me, I have given all the details of his recovery. He is still today doing extremely well, fit and active, canvassing for Hegde that sans ICU, sans blood clot busters, all treated using the BM pulsar. Not reality. If that is anecdotal, we have had 100 such cases afterwards. So we have documented all these for everyone to see. Next, please. Then to show you that associated complications of diabetes where there is a almost amputation-like stage of a diabetic foot in a superintendent of police, the BM pulsar helped in 4 months for nails to grow, auto stem cell formation due to the electromagnetic pulsar. We had a very severe case of block of the aorta called Lerish syndrome, which is a serious condition without any blood supply. This lady was living in scanty supply. Her left kidney was altered in shape, and it became normal in shape after 4 months of this therapy. Next slide, please. We have, people think, formerly when I was a student, any hemorrhage in the brain, we will give him up. We said, don't treat him, it will go. Otherwise, he will be a vegetative person. Please don't treat. We have this lady who had a massive hemorrhage in the brain. Again, this hemorrhage was due to prophylactic use. She didn't have any reason to take aspirin, but she took aspirin for a long time. So this lady was completely bedridden and coma for 3 days. And 3 weeks later, a person who could not affix her, who could not recognize anybody, who could not talk, who could not affix, could not walk, she was walking. She's doing very well even today. This is about a year ago. Next slide, please. Now, what about other conditions which we have treated? Parkinsonism. This man came, we used to play a game called statue. Children will run. When somebody shouts statue, everybody has to stand like that. Now this man with rigidity of Parkinsonism came to us like a statue, a frozen statue. He could not get up, he could not talk, he could not remember, he couldn't eat his breakfast. 24 hours after this therapy, you would be surprised that he was walking. His drug list had halved. His drug list was reduced to 50%. These are facts because this man is still going very strong, coming regularly for follow-up. He can swing his arm, he can walk on his own, he can talk, and 80% of his memory has come back. Next slide, please. Well, lumbar disc is one of the big businesses in medicine. This lady had 3rd-degree lumbar disc prolapse, a very severe total lumbar disc prolapse. She chose to opt for conservative therapy with BM pulsar, and she can herself recount, if you meet her, how well she became within a month and within 3 months. And now she is as active as ever before without one knife having touched her body. Next slide, please. The abdominal pains, the previous slide, please. Abdominal pains, even bleeding from the ulcers and various other acidity, hyperacidity conditions remarkably are helped by this energy device. Next slide, please. Now we are also trying to do some pilot studies with a particular water called electrolyzed alkaline water, which Professor Vladimir Vysotsky had come and demonstrated to us last February of University of Ukraine in Kiev. Our usage of this has shown us that we can use it for a lot of conditions according to him, but we have tried a pilot study in about a few hundred cases, I think, and 48 of these cases have cleared their urinary tract infection without antibiotic or with very, very minimal dose of the antibiotic. Now, this is a very interesting finding. We are following it up. We have a lot more work to do because this is supposed to have. Do you know that water is the biggest market today? I find one of the biggest companies of India have taken over in a joint venture to produce water because it says that annual income from water is 750 crores. That is the market. So, if we can give our people water, we give this free because we can get 300 liters of water from this machine. Now, if government can use this sort of thing, so ours is a model research center where we authenticate what we say and then we will pass it on to the benefit to the public. Now, this is the interest that we have got in using this, not making any commercial gain. And that is why voluntary health services is different from other hospitals. Next slide, please. Well, you talk about all big things, but an old joke says that a cold which gets cured if you take treatment in a week, and if you don't take a treatment, it goes for 7 long days. But do you know, people who want a big meeting to go to and have got a severe cold, anything to pop, they pop all the pills, they become drowsy and talk some rubbish in the meetings because they take all these antihistamines which dull their wits. So we thought, what is it in the market? Now, we are not promoting anything because we just searched. It is like a Google search. Hundreds of, thousands of remedies are there. We found a remedy where by just inhaling it every 2 hours, and here is a gentleman who will vouch for it for me, who is sitting in the front row, I don't want to name him, and his chronic cold went away in 12 hours, and in 3 days the cold disappears. So we have halved the half-life of cold into nothing. So this is another one which has proved to be a roaring success. So I think we are not researching only new things, we are researching existing things. This is where we grasp what all we experienced. We didn't grasp less than what we experienced. So whatever we experienced, we are sharing it with you. Then we have got some oil applications at that and this and all that. But one of the other runaway successes in these pilot studies is very good news for ladies. We found a very interesting oil which cures not only hair fall but also prevents migraine. Don't ask me how, because that needs more money and more research. Next, please. So, the clinical details and results of all our conditions treated as outpatient, daycare, and all these are available on our unique electronic medical record for future reference, clinical practice, as well as education and research. We are grateful to our high-level ethical committee headed by our President Swaminathan and under the chairmanship of Justice K. Sampath, a retired judge of the Madras High Court, to whom we are greatly indebted for guiding us in our research activities, making absolutely sure that human rights, we have got a very, very big human rights man there, public interest and well-being are protected at all stages, and we are always open for criticism, for improvement. We thank all of you. We thank all our donors, well-wishers, management and staff of the VHS, and our own dedicated and enthusiastic doctors, nursing staff, and all the support staff of the VHS, the TAG Research Center, and the Healthcare Info Solutions, who have made it a year worthwhile in fulfilling our dream of a state-of-the-art model research center that offers cost-effective, comprehensive, multimodal, safe therapies in healing complex ailments so that we feel we can lay a stake, but it's for you to decide whether we can claim the, next please, the green certificate for healing. We seek all of you to come to our center to see whether we deserve this green certificate with our environmental friendly, human body friendly therapies at our center. This model is replicable either in group clinical practice. So it is just a model. It's not a hospital. It's a model to show that it is possible to do this. In small, medium or large hospitals, whether it is in the public sector, private sector, NGO or the charitable trust societies like ours, to help human beings at large regain their health expectancy. I repeat, next please. Again, go back to Ralph Emerson. He said, is it not our genetic responsibility in lending our hands in building that collateral bridge of connecting the present generation? That was our mission, connecting the present generation with the greatness of the Indian wisdom, which stands with complete mutedness, awaiting for rejuvenation of the Indian minds. This is exactly what we are attempting to do. Whether we have succeeded or not, it's for you to say. And Ralph Emerson's perspective was sent to Professor Hegde by this gentleman, Rajshekhar, and his perspective of India is true even today. Next slide, please. Thank you for patient listening.
Thank you very much, Doctor, for lucidly highlighting the center's activities. We now call on Dr. A. Ganeshan, Associate Director of Clinical Research, TAG VHS, to introduce our chief guest, His Excellency, Dr. Stefan Weckbach, Consul General of the Federal Republic of Germany in Chennai.
Our renowned chief guest, Dr. Stefan Weckbach, is a very high academic in economics, having graduated from the University of Frankfurt am Main, and has excellent research credentials and experience before entering the diplomatic service of the Federal Republic of Germany in the year 1983. He has served in various and increasingly important capacities in the German Embassy in Montevideo, Budapest, and the Federal Foreign Office Bonn, the then capital of the Federal Republic of Germany. For 2 years from 1990, he was advisor to the SPD parliamentary group in the German Federal Parliament. He returned to diplomatic service in 1992 as Deputy Head of Mission Rio de Janeiro, then Buenos Aires, Madrid and Colombo, which was his last station before coming to Chennai as Consul General. It is worthy to note that for 3 years, he was the Deputy Head of Mission in the permanent delegation of the Federal Republic of Germany to the UNESCO Paris. His Excellency Dr. Stefan Michael Weckbach is 62 and married with 2 children. On behalf of the TAG VHS Diabetes Research Center, it is my privilege to request him to release our second newsletter tagline and then address the audience.
Senior diabetologist, to honor our chief guest with the traditional Punnadai. We now request Dr. E.S. Krishnamurthy to present a plaque to His Excellency Dr. Weckbach. Thank you, sirs. We now request His Excellency Dr. Stefan Weckbach to release the taglines newsletter specially prepared for the occasion by our executive editor, Ms. Priya Ravi, and we also invite her on the dais. We request Professor Hans-Peter Dürr to receive the first